All right. Welcome in, everyone. My name is Delaney McWalters. As you probably know by now, I've been doing a bunch of these great interviews for Lupus Awareness Month this May. And today we are joined by someone that's a great part of our community that is affiliated with UMass Memorial and is going to talk to us about a bunch of different things today. Ruth Wilson. Ruth, do you want to introduce yourself a little bit?
Sure. Thank you, Delaney. And thank you so much for having me here today. So my name is Ruth Wilson. I have lived with lupus for over a decade now, and I am deeply involved in lupus advocacy and, through the Lupus Research Alliance, but I'm also the moderator for the lupus support group at UMass Memorial. And that's actually how I became involved with a lot of like the symposiums that that you guys put on with you, in collaboration with UMass. And so because of my lupus, this sort of my journey kind of led me to blend my professional work with the science about lupus, and also my passion for advocacy, education, and support for others living with this disease.
Yeah, absolutely. How old were you when you were diagnosed?
So I was diagnosed when I was 30.
Wow, that's later in life. I mean, I shouldn't say that. It kind of varies, right, with folks experiencing different symptoms. But I was talking to a woman the other day that was diagnosed when she was 12, and so she's never really known a life without lupus, So yeah, that must have been a very trying time.
Yeah, and I feel like I had lupus for a long time, but as you know, getting a diagnosis is like one of the problems, right? You don't get a diagnosis right away. So my journey began with years of unexplained symptoms like muscle pain, muscle weakness, joint pain, fatigue, migraines, unexplained bruises. I had rashes. I was hospitalized 2 times. Because I had like all of these different symptoms, but they were never able to tell me exactly what was wrong with me. And ironically, it wasn't until my kidneys got involved that I got the full diagnosis and the full picture of what was going on in my body. And what's funny is that before I got diagnosed with lupus, I was seeing a rheumatologist because my primary care doctor sent me to them, but I still didn't have a diagnosis because my lab work wasn't quite there. And so that doctor at the time didn't give me the actual diagnosis. And it wasn't until I took myself to the ER room one day and asked the doctor there to just test my urine and see if I had nephritis, because I was having a lot of the symptoms. I was having like high blood pressure. I had a lot of inflammation in my face and my extremities, and I had the typical, urine, right, like frothy, amber colored urine, and so they tested me at the ER, and like that, sure enough, I had lupus nephritis, and it was very advanced. And they said, if you don't see a nephrologist right away, you're going to lose your kidneys. So that's when I actually got diagnosed with lupus and lupus nephritis and got into a treatment. First was to, save my kidneys. And then like after that happened, then it was like a treatment to sort of maintain the disease.
Yeah, it just goes to show that the power of self-advocacy is, I mean, I wish that we didn't have to be so hyper vigilant with, tracking symptoms and just really being so in tune to our own bodies. But at the same time, like, if you hadn't have spoken up and just that self-advocacy piece, I mean, who knows how long it would have taken you to get an actual diagnosis and begin treatment.
Right. And I think that's why it's so important to educate yourself and to speak up, right? I think like before that instance, I, for a good 6 years, that I didn't get the diagnosis, I really relied on my doctors. I completely, blindly believed them and thought that they were doing the best for me. And I never asked any questions, but it wasn't until I started asking questions and like sort of educating myself on the disease that, I was able to get the answers that I needed. So I always encourage everyone to educate yourself, ask questions, be prepared when you go to your doctor with those questions, so that you understand the full picture and, you understand your treatments and your medications. It's so important to advocate for yourself, for sure.
Yeah. And I also feel like, as women, we're often told like, oh, you're a hypochondriac, or oh, you're crazy, or oh, whatever. But I just want to reemphasize to anyone listening to this that you know your body better than anybody else knows your body. And sometimes Google is not the most helpful place of information, because it can just be really overwhelming and scary, and there's a lot of noise out there. But if something seems off, if something is really bothering you, like, you don't have to suffer in silence, I guess would be the message.
Yeah, absolutely. Especially for people that have just been diagnosed. I think that's a message that really needs to be, repeated constantly. You need to advocate for yourself. You need to speak up, because I think, like, at the beginning, especially for me, at the beginning of this journey, I just felt like I was in a room with doctors screaming and nobody was listening, right? So, finding those ways to speak to your doctors, to have those questions, and to make your voice heard, because yeah, we get dismissed a lot, and I definitely did at the very beginning.
Yeah, absolutely. Tell me about your work with the Lupus Research Alliance. What does that look like?
Yeah, so with the Lupus Research Alliance, I started doing a lot of the walks with the Lupus Foundation of North of America first, and then somehow I found like the walks for the LRA, and so I started going to the walks as well. But that was about all that I did at the very beginning. And I think it was at the beginning of my journey, I was still kind of coping with my disease and didn't want to really talk about it too much with anyone. Not understanding that it's so important to talk about it, especially at the very beginning, because you learn so much, right? And so I didn't really become involved with the LRA until I had an opportunity to go speak to a group at Harvard, and they had so many questions. And then I realized it was like an eye opener for me, because I realized, oh my goodness, like, these are the doctors that are supposed to save patients like later on, right? Because these were all med students, and they had so many questions of things that I thought were pretty common, right? That they should know because they're doctors. But I realized that they understand lupus in a textbook, but they don't really understand the patient experience, right? And so after that happened, I realized I need to get more involved, and I need to speak up and talk about my journey and my story, so that people can understand lupus, and researchers and doctors can get better at what they do. So that we can find those treatments for people like me. And so I started to sort of talk to people at the LRA and got involved in this group called the Young Leaders Board. And through the Young Leaders Board, I started to do a lot of projects, volunteer projects with the LRA. Like, we did a cookbook for lupus patients. And then they had me talk to their whole staff one day. And the feedback I got from that talk was overwhelming. Everybody was just so grateful that I shared my story, and that they felt like they were making a difference, and they understood why they were doing what they were doing, right? And so after that, I just I've done other things with the LRA. I still continue to do the walks. I do the PALS program, which is it's a group of people that we sort of mentor other people that are thinking about joining a clinical study. And because we've gone through it, we can talk to them and sort of answer any kind of questions from a patient perspective to make them feel more comfortable about participating in clinical studies, and also to remind them why it is so important that they participate in those, right? So I participate in that. There's another program that I also do with the LRA called Patient Protocol Review Board. And this is a group of people that we get the clinical studies from companies, big companies that are, trying to run these clinical studies for their drugs. And so we get to see them and help them from a patient perspective, like help them sort of design the study, right? To make sure that the patient voice is heard, and to make sure that the sort of like the primary points or the endpoints of that study and the way that they're running the study makes sense for a lupus patient. So I do that too. Yeah, they've just been really great at letting me participate in all of these things, like going to conferences and speaking on behalf of the LRA, and just telling my story, right? Because I think it's so important to remind them why it is that they do what they do.
Yeah, and I think bringing it into reality in a way is a really important piece of the puzzle in this whole thing, right? It's like when you were talking about the doctors at Harvard or the students at Harvard, like, yeah, lupus can look one way in a textbook or on a piece of paper, and you can learn all of the information that is available about it. But until you actually work with a real human being that is experiencing this disease on a daily basis, and you see what their daily struggles and triumphs and all of that looks like, I'm not going to say that the textbook information is irrelevant, but it's applying it in real life scenarios is what medicine actually is, right? It's not theoretical. It's not done in a lab. It's done with two human beings or more in a room having conversations and making decisions about treatments, right? So I don't know, that part really struck me, because I think we're so quick to take the human side out of healthcare because it at times seems so scientific or whatever. But I just really appreciate how you bring the humanity back to research.
Right. And I think, like, as doctors are treating patients, they need to think of it as not like one model fits all, right? Because a typical day for me is not the same for another lupus patient. We are all different. All of lupus is very different. It's a very complex disease, right? So, and we all have different triggers, right? So I feel like, if for new doctors, especially if they think of lupus as this one disease and this one treatment, like this one standard treatment, they're not going to be addressing really what the patient is going through on their daily life, because like they need to have that human component, so that they understand really what they're going through.
Yeah, absolutely. Talk to me a little bit about the mental health challenges that can come with having lupus. As a person that runs a support group, I'm sure that this is something that you interact with and talk about a lot. This isn't something that we've really covered much in these interviews up to this point, so I want to make sure that we do.
Yeah, absolutely. And thank you for asking for that. It's funny. I just spoke at a community meeting for the LRA about mental health and how important it is, right? Mental health, I feel like, is one of the things that we don't talk about, but is one of the hardest part of dealing with any chronic illness, right? Especially lupus, right? So dealing with depression, anxiety, that cognitive dysfunction that you hear about, the lupus brain fog, that doesn't show up in the labs, but they really do steal your life, your everyday, and trying to sort of keep a job and be active with your friends and at home, like the mental health aspect is so important, right? It's not just about you have to change. You have changed your life, right? When you got diagnosed, your life is completely different, and that change can cause a lot of anxiety, a lot of depression, and then also dealing with all of the medications. Because we take a lot of medications, and the changes of the medications, right? Because you might start using something, and then after a while it stops working. So now you have to change the whole medication regimen, and the side effects of all of those medications, on top of what you're already going through with your illness, is it can be a lot for people, and I hear it a lot from the community and people in the support group. They deal with it, and it can be really hard for people that don't understand lupus to understand why that person is depressed, right? The fact that they have so much pain that they can't walk that day, or that they feel defeated, and so they like might not even eat that day, right? Because of like their depression and anxiety. And then this cognitive piece of it where you know what you're supposed to say, or you know what you are supposed to do, but you just can't get it out that day, right? And that happens a lot in my life, like every day, and in like lupus patients, right? That fog that they just can't. There's nothing that they can do to make it go away. Even if you try to get a good night's sleep, like that might not help. And then on top of all of that, you have migraines that you're dealing with, and it's just it's a lot. It's a lot, and they're not like that many clinical studies that are going on, or clinical trials that are going on right now in research for addressing this part of lupus, right? And I feel like they see this as like a secondary side effect of lupus, but this mental health, this lupus brain fog, this is lupus, right? Like you wouldn't have this if you didn't have the disease, right? And it's part of the patient experience. Again, it's the whole picture. It's not just this one aspect. It's part of it, and it needs to be front and center. It needs to be talked about, and it needs to be researched because it's important.
Yeah. Yeah, absolutely. And it's like having the disease is one factor, but the toll of managing the disease it's like a double-edged sword of you need to do the things that you're talking about, the medication management, the daily symptom management, the explaining to people, it's unfortunate, but oftentimes the person with the disease, whether it's lupus or something else, has this role of like educating people about what it is that they're experiencing. I would encourage people to kind of do their own research, but just all of that combined just frankly sounds exhausting. And yeah, the mental health toll that living that way can take is not to go under noticed, I guess.
Yeah, exactly. Yeah.
So I guess with that in mind, what are some what would you say to somebody maybe that's newly diagnosed, or is dealing with like a friend or family member that's newly diagnosed, about how to start the process of dealing with the mental health? I mean, not only the brain fog, like the actual symptom of lupus, but also the mental health concerns that lupus can cause outside of that,
Hmm. Yeah, the first thing I would say is you're not alone, right? I feel like for me, when I first got diagnosed, I just felt so lonely. And I didn't know a lot about lupus and where to go find help. So, one thing is, you're not alone. You need to find the resources, ask your doctor about resources, or search right on the web, although that isn't always the best place, but you will come across organizations that will give you like resources and education about what the disease is, right? You know, you at the beginning, you'll grieve the life that you had, but you will also build a new one. And you'll find strength in places that you never expected. So, you know, don't be afraid to speak up. You are the expert on your body, and there is life beyond the diagnosis. You know, you deserve to live your life fully. But I think what I would tell people is that you need to find that community and that support group in that medical team for you, you know, because you're going to need help, right? And I feel like I would tell people, I always tell people this, that balance isn't just like a finish line, right? It's practice, right? You're going to be changing things and learning new things about your disease, and new things will come up, right? Um, like when I got diagnosed, you know, I had SLE, lupus nephritis, but throughout my journey with lupus, I've had other issues that have come up because of my lupus. Like I've dealt with pleurisy, and, you know, I've had rashes that I didn't have before, and hair loss, right? Like you're going to deal with all these different things. So it's so important to have that support system, to have that support group, your family, your community, to get involved, to educate yourself, because that will empower you to feel like you're making a difference as well. Like, you know, because when you first get diagnosed, you feel like everything's taken away from you. Like the life that you plan is no longer that, right? You feel powerless. But if you realize that you can turn your story into strength, into something that can help someone else, you know, participate in the walks, do awareness posts on your Instagram, you know, and eventually find your way to that LRA or to that lupus community that you know makes you feel whole and, you know, seen. I think is so important, right?
Yeah, absolutely. Community is not to go undervalued in this at all. Thank you so much, Ruth, for your time today and for speaking to us about this. I think it's great to get multiple angles and multiple stories and perspectives on this very complicated, nuanced, individual disease that we're really just trying to bring awareness to this month. So thank you.
Yeah, of course. And just one thing I wanted to say last, you know, is the fact that there is hope, right? I feel like that's what makes me stay grounded on the hard days that I have to get through, right? It's the people, the researchers that are working tirelessly to behind the scenes, and the advocates, right? Raising the awareness, like those patients who refuse to give up, that community, right? So that gives me a lot of hope. You know, of all the progress that we've done so far, right? Since I got diagnosed, there's been a lot of progress, and we are talking more about lupus. So yeah, just remind yourself on those hard days that there are people that care. There are people that are working tirelessly, and you know, and like you've made it through every hard day before this one, so you'll make it through. Like we'll get there, right? So yeah.
Yeah, absolutely. Where should people go if they want to learn more info on the support groups?
Well, so there's a lot of different places that you can go to. The Lupus Foundation of America has a whole page with a lot of different support groups throughout the country that are chapters of the Lupus Foundation of America. The LRA also has their resources page, where you can find a lot of different resources, a lot of different videos that they've put out about cognitive health, about fertility, like there's different YouTube videos that you can go watch. And then for in terms of like UMass, you can go to the UMass Lupus Clinic website, and it'll give you a link to sort of sign up for our lupus support group. And we meet once a month, sometimes more, just depends. But we meet once a month, and it's all through Zoom. And a lot of these support groups are through Zoom too, to make it more easy for the patient. So just trying to find those groups that you feel comfortable in, I think is really important, and everybody should be doing.
Yeah, absolutely. Well, thank you again. And I think we had a lot of good little nuggets of wisdom for folks in this today. So thank you.
Thank you.